A question that I've gotten maybe 3 or 4 times is, can my eyes reject the lens implant? Um, I don't think that's happened. To my knowledge, that's not happened in the last, many, many decades. Let's say the last, I don't know, ever since this surgery was born. So um, let's use this as a opportunity to visit the history of cataract surgery, which, as you know, is the same as RLE surgery. But during World War II, there were fighter pilots who had shrapnel, go into their eyes from the windows of their planes, like the cockpit. And they noticed that these glass shards are very dormant inside the eyes. They don't cause any inflammation. The eye's not rejecting it. So, Dr. Ridley, who invented intraocular lenses and cataract surgery, decided that, well, why don't we put in a lens after we remove the cataract? Because prior to that, I believe you just remove the cataract and you leave the patient without a lens inside their eye, and then they wear these like Coke bottle thick glasses afterwards. So Dr. Ridley then created these lenses that had power and then placed them into the eyes. And of course these are lenses that can't fold. They're some kind of very hard material, possibly glass, and so you have to make big incisions, stuff them into these patients. Had to live in the hospital for some duration of time, many days if not weeks, until things healed up. So as time went by and everyone determined this is very safe to do, and we haven't seen any adverse reactions to any of these materials, decided to create, well, even more useful materials. So now higher index of refraction, so you can get the lenses a lot thinner, and then softer, and so you can fold the lenses. That way you don't have to make a huge incision. Nowadays we make a 2mm incision. 2mm is quite small. It's and then you can just insert this lens, which is nice and folded up in a taco shape, and then it unfolds inside the eye. So that's sort of a bit of the history. But to answer the question, which was, does the eye reject these lenses? The answer is no. The eye is immunoprivileged also, which means that the eye kind of has its own immune system, separate from the body's. As you know, there's the blood-brain barrier, but there's also a blood-eye barrier. Sometimes this can be compromised in uveitis, where the blood-eye barrier kind of breaks down, and then your immune system can attack the eye. But I don't think I've ever heard of the immune system, whether the eyes or the bodies reject the intraocular lens. So it is a very safe surgery. I don't think you need to worry about that.